Yeah. Yes. Right here we are. So Anuja, Dinosha, Gretel, Phil, Shams. Right. You hear a specialist respiratory nurse briefing a group of trainee nurses. You hear a specialist respiratory nurse. So this is the person who is speaking. This is the person who is speaking now. Okay. Question number 26. Now brainstorming session plan. I'm going to explain you the plan. Okay, now I'll not give explanation, too much explanation like previous one. I'll go a little short. Slowly, we'll reduce the explanation so that you can do it on your own. So, background sentence. What can we infer from this background sentence? This is the first part. This is the background sentence. Okay. So, what do we infer from this background sentence, this particular sentence? Okay. So, you hear a specialist respiratory nurse briefing a group of trainee nurses. What can we infer from this? Now, who is the medical practitioner? Who is the medical practitioner? A nurse. Okay. A nurse. Nurse. And what is the specialty of this nurse? Respiratory nurse. Specialist respiratory nurse. Specialist respiratory nurse. Okay. Nurse and specialist respiratory nurse. Fine. This is related to breathing. This is related to breathing problems. You can understand now. Respiratory nurse, respiration. So breathing problem, right? So who is the patient? So here no patient, but you have an audience here. Who is the listener? So group of trainee nurses. A group of trainee nurses. So she is giving a briefing. That means the nurses don't know. So she is giving a brief information. So there is no patient here, but there are some other people who are listening. There's a nurses, trainee nurses. So nurse with trainee nurses, nurse in profession, professional nurse and trainee nurses. That you have to see here. Next, what is the case? It's a training or it's a briefing session. It's a training session, training, under training. So the trainer is training the trainees. This is a training session, because there are trainee nurses. Okay. Now, what to do during an asthma review? During an asthma review. So what to do? Okay. So worth taking the time to do what? Okay. During an asthma review, it's worth taking the time to do what? To do something. To do something. To work or to ask or to establish. To do something. What should she do? She should work or she should ask or she should establish. So there's a point. Now, so here you see, this is a training session. Training session, you can see. Because training nurses, training session. Under training. Training session. Okay. So, training session. Now, next. So the case is a training session. Where are they talking? In a training room, likely, or hospital educational space, or staff meeting area. So they are talking maybe in a training room, training session, or a staff meeting area. Okay, meeting room. So what is the mode of talk? It's a consultation, or it's a lecture, or training, or interview, or training briefing, or educational talk. Next, question stem sentence, second one. This is the stem, question stem. Okay. Now, she suggests. So this is a suggestion. This is a suggestion. Okay. This is a suggestion. Earlier it was thinking. She thinks. But here she suggests. She suggests. She is suggesting something. Why is she suggesting something? Because that is good. Okay. She is not suggesting something else, because that is not useful. So you suggest something which is useful, you suggest something which is beneficial, you suggest something which is good, which suggests something which is positive, advantageous. So you suggest something because you are the boss, you know everything, the others don't know anything. Okay, they don't know 100%, they don't know clearly, they don't know perfectly. So the teacher and the students, like that the trainer and the trainees. Who knows more? Trainer knows more. So trainer can suggest the trainees, but the trainees, they don't have idea, so they cannot suggest the trainer can suggest the trainees. So that is the higher level to the lower level, that is called suggestion. Okay. That during an asthma review, so she is suggesting about an asthma review, right? Now, the type of question, what type of question? This is a fact-based question. This is a fact-based question. That means what you hear, that only you have to write. The truth, what she speaks. Actually, the same thing is not inference-based question or theme-based question. It is a fact-based question. Questions are different types. Slowly, we'll understand. So the previous question was fact-based, but cause and effect. Okay. And this is also fact-based question, right? But what it is a suggestion. Okay, this is a suggestion that during an asthma review, that means this is not going on now but possible future. So suggestion will always point towards a future. Okay, now is present tense, but suggestion is for future. Suggest, whenever you say for future, present or future, from now onwards, that means later. So I suggest you to work hard. When? Tomorrow, day after tomorrow, this week, until your exam. So future tense. Okay, suggest. Suggesting not for now, suggesting is for future. So after now, you have to do. I suggest you to work hard. I suggest you to do one test every day. I suggest you to do one reading, one listening, one writing, and one speaking every day. I suggest. When? In the past? No. Present? No. From tomorrow onwards. So suggest in the future. Suggest now, but it is for the future. You suggest somebody something so that in the future they will do that. I suggest you to wake up every day at 6 o'clock. I suggest you to spend 3 to 4 hours every day for OET. I suggest. For when? When? Am I telling you to do something in the past? Am I telling you to do only today or now? Or am I going to tell you what you have to do in the future? Suggestions are always meant for future. Remember that. So this is called reading between the lines. So last time I told you, okay, action is going on. That means started before and the result is now. So past, okay, it was started. Present perfect continuous tense going on. Okay, and now we have the result led to. So here suggest what? During an asthma review. During means ongoing, future ongoing means future continuous. Okay, future continuous. During means in that time. During an asthma review, that means when you are conducting ing during, when you are conducting an asthma review. During means at that time. During means at that particular time. Yeah. At that particular time. That means future. So in the future, tomorrow, day after tomorrow, next week, after a month, after a year, after an year. So now what you are doing? You are conducting an interview. When? Tomorrow. At what time? 10 o'clock. So 10 to 30, you are conducting a review, asthma review. 10 to 10:30 for half an hour. During that time means when the thing is going on in the future, that particular time, in that time, after starting and before ending, that particular time is called during. Okay. So it's worth taking the time. Taking again continuous. Okay. Taking the time. That time you should take the time. Time to do what? To do something. What should you do? What should you do? That's it. So if you see there, what are the important words? Suggests. Okay. During an asthma review. Second one, worth taking the time. Okay. Now here the preposition is to. To do something. To do. Okay. I gave a pen to him. That is pen and him. Now. So here worth taking the time. Taking the time to. Time to do something. To do. So here this is a to infinitive. So infinitive verb V1 will come here. What will come here? V1. Verb V1 means original verb, base verb we call it. Base verb. Okay. This is called base verb. Yeah. V1 means base verb. To do, to sing, to dance, to jump, to work, to ask, to establish, to teach, to train, to clean, to wash. So it is first form. Okay. Not past tense. Look. Okay. Keep, kept. See, saw, seen. So first one is called the base form. The original first word is called the base form. So time to work or ask or establish. So now we have to focus on this one. Right here. To do what? To work or to ask. To do something. To do what? To work. To do. Do what? Something. To work. Work what? To ask whom? To establish what? So, like this. To do something. Do is work or ask or establish. Doing something. First time, do is work. Second one, B. Do is ask. Third one, C. Do is establish. Do what? Something. Work something. Ask somebody. Okay, establish something, like that one. You have to think like that. So, right, something that should is more important. Okay. So to means action. To means time to action. What action? What action should be taken here? So this is action. Some action which is going to speak. Right. Some action which is going to speak. So suggests. Right. Now let's go to the next one. What is the keyword point to the answer? Worth taking the time. This is going to be very important word here. Okay. This is going to be the very important word here. Worth taking the time. Okay. What is worth taking the time? So to do what? That's it. Now, so meaning she emphasizes a specific action as very valuable, worth taking. Worth means valuable. So worth, this is the key word. So what are the synonyms for this word? What are the synonyms for this word? Worth means valuable. Valuable or beneficial. or valuable, beneficial, or advantageous. So like this. Okay. Valuable, beneficial, advantageous. So these are the words that you can think of. Next. What part of speech is expected? Okay. So worth taking the time means important to do something. Essential, beneficial, recommended. Okay. So don't skip the step. Don't skip the step. What are the symptoms of the keyword? What are the synonyms of the keyword? Now the synonyms of the keywords I have given you: valuable, beneficial, advantageous. Some other thing is essential, 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 and you can say beneficial, essential, advantageous, recommended, recommended, or do not skip, do not miss or skip, do not skip this step. So like that you can say, right? So these are some words which will tell you that, yeah, it's worth. Next, what type of words should we focus on? Actions involving. We should focus on what? What is our focus? Last time I told you, facts, focus. Focus on what? Action involving words. Action involving words. So focus on action involving words. Action involving words. Right. What are those action involving words? Teaching, okay, or checking, or demonstrating, or ensuring technique. So these are the words which you can focus on. So I'm going to give you the words here. So teaching, or you can say checking, right? Another word is demonstrating. Another one is ensuring technique. Okay. So these are some words which will tell you about actions. Okay. So those are action involving words. All right. Now, option A. Now, what is option A? Work through some simple exercises with the patient. Now, what are the words here? Work through, exercises, and patient. These are the words. Work through, simple exercises, and patient. Okay, we know that it is patient. Okay, he's talking about patient here. Okay, work through some simple exercise with the patient. Ask the patient to demonstrate exactly how they use the device. So here, ask the patient, demonstrate, okay, use a device, device. So these are some words which are very important, right? So if you see first one, option A, work through exercises patient. So the key word is exercises. So this is more important. Exercises, more important. So to focus on exercises, action involving words, to focus on exercises, work through some simple exercises. Exercises is more important with the patient. Okay, the most important words: work through, simple exercises, patient. So what are the most important? Worth taking time to work through? No. Work taking time to patient? No. Work taking time to simple exercises. So this suits there. Action involving word. Work through, simple exercise. Exercise is action. Okay. So go through some simple exercises. Exercise is action. Okay. So focus on that one. Next one. So, what are the words which may go with this one? The words which may go with this one are practice exercises. Okay, here I am writing below A. Practice exercises. This you may hear in the audio, or guide through movements. Guide through movements. Guide through movements. Or you can say demonstrate exercises. Demonstrate exercises. Or you can say exercise coaching. Okay. Coaching, you can say. Right. So coaching or training, demonstrate, practice. Oh, sorry. Exercise spelling is gone wrong. Okay. Yeah. So let's. Okay. Guide through movements, demonstrate exercises, coaching. So these words you can hear there. These words you can hear. The next one, next question. Option B. So exercise practice is not usually central in the asthma review. Okay. Right. Next one. Keyword. Ask the patients to demonstrate exactly how they use a device. So here, ask, demonstrate, use a device. These are the words, keywords. Okay. Ask, patient, demonstrate, device. Right. Now, so patient, patient, patient. Everywhere is patient. So here also patient. So patient is not that much important here. Yeah. Now, so demonstrate exactly how they use a device. The keyword. Demonstrate exactly how they use a device. So here, first one exercise, second one device. Device is more important here. You have to focus on device, using a device. Okay. So using a device. So device is the keyword. Focus for device. What device means? Instrument, okay, or apparatus, or instrument. Right. So it is a verb phrase, to do something. To do something. Show how they operate the inhaler. So here you can listen to this one. So it is breathing problem. So how to take time to show how they operate the inhaler. Show how they operate the inhaler. So they will speak differently. No? They will not speak the same things as in the question. Or check technique. Check technique. Check. Right? Or they may say observe device usage. Observe device usage. Or assess inhaler handling. Assess handling. Yeah. So assess handling. Show how they operate the inhaler, or check technique, or observe device usage, or assess handling the things. Next one, C. Option C, analysis. Now let us see. Establish when the patient can take over the responsibility for the treatment. So what are the keywords? Establish, patient, then next one, take over responsibility, take over responsibility, take over responsibility, treatment. So what is the most important word here? The word is take over responsibility. So responsibility is important. So responsibility. So patient is taking the response. First one is exercises to the patient. Second one is a device, okay, demonstrated by the patient. Third one, responsibility taken over by the patient. So patient is common. So exercises. First one is focusing on exercises. Second one is focusing on device, a device. Third one is focusing on responsibility. So till now we have taken when you are going to take your own responsibility, that is C. So we have taught you to use a device. Now show me how you are using that device. And first one, exercise. Okay. So you have to practice some exercises. Okay. So with the nurse, you're going to practice the exercise. So focus on exercises will be A. Focus on using a device is B. Responsibility, who is going to take? Till now we have taken, now you take your own responsibility. We are not going to help you, you have to help yourself. That is C. So this is the way how you will analyze this particular question. So simple as that one. Earlier question I have explained in a little detail, but now that you understood, I don't think I need to explain too much for you. So you can go ahead and you can practice. Okay, right. Yeah, Dr. Shams. Any doubts? Anybody?
No, it's fine. It's
So is
clear.
that clear? To some extent, I reduced the length, but I think you got the essence, everything. Okay, if you do practice like this for some questions, okay, you practice on your own. Oh, technique, spelling mistake. Right. So that is how you will get the ideas. Practice. So here we got one spelling mistake, typing mistake, ne? And here we got one spelling mistake. Okay, right. Those spelling mistakes are there. So let me say try. Yeah, you tell me anything new you have learned now.
Yeah, this technique, I think is very good and effective,
Okay.
especially
So,
for part B.
all right. Technique. Yeah. Okay. Right. Next, Gretel. Yeah, Gretel. Is that clear to you? Oh, and Anuja, if you have any doubts, you can ask me.
Yes, sir.
Yeah.
I
Did you get any new points here?
suggest, sir. I got that.
Hmm.
Suggest. Then I know how it is now. It is future.
Hmm. Suggest
And
it suggests about the future action to take.
yeah. Then other thing is it's same as previous correction. So now I know how to think about that, sir. Thank you very much, sir.
Yeah, good. So that's the end of this particular question.